So I have on my episode today Dr. Abdulwassay, who has been an industry expert and has been dealing with medical cases and claims for the last 10 years. He comes with a huge expertise, and I thought it'd be best to address all the questions that were asked to me through Dr. Abdulwassay. Hi, Doctor.
Hi, Ron. Thank you so much for having me on your show. Very informative, and I am a regular viewer of your informative videos. Very enlightening, and thank you for having this.
Thank you so much. The pleasure is all mine. So, Doctor, you've been in the industry for almost 10 years, and you've added a lot of expertise to a lot of people. I've seen you making a difference to the community, the society at large, definitely. And you've always come up with some amazing advices. And
Thank you so much.
I've personally experienced that as well. So there are a few questions which viewers were asking me and people were asking me, and I thought I'd reach out to you to ask these questions. So the first question is, why is it so important to take health insurance?
Yeah, so insurance as such, as you are aware, is risk protection. So we are faced with a lot of risks in our lives, and most of these risks are covered in some form of the insurance or the other. And health is one of the most important aspects of our daily lives. This is protected in a way through health insurance, and these risks can happen anytime, as you are aware. Any emergencies can happen to anyone. So in order to have yourself better protected, it's always advisable to have your health insurance, because the way the medical expenses are increasing, especially in the commercialization of the hospitals and the tests and the treatment costs, it becomes simply unaffordable for a normal person to spend that much cost.
But most people, when they take health insurance, the thought that comes to their mind is, oh, it's an expense. And also I've seen most people trying to cut edges. Can the premiums be lower? Can you make it lower? And things like that. So what is your thought on that?
You cannot term it as an expense. Actually, it's an investment in your health or your well-being.
Yes.
Firstly, you're protected from the risk, and again, the financial limitations that might cripple your treatment process will not happen when you are protected through the plan.
You're so right when you say that, because at a time when you're fighting disease or ailment and you're already under stress, whether it's for yourself or your well-being, the last thing you want to fight out is the bills.
Exactly. So the financial worry should be the last worry.
True.
And at that point of time, you or your family members should be more involved in the treatment aspect, discussing the treatment rather than arranging for the bills or earning for the money part.
Absolutely.
And again, this is the biggest advantage of health insurance, that in most of the policies you get direct billing, which is a direct coverage without paying money upfront, and expenses are handled by your insurance company. And this is one of the most important factors which can help in your management of your disease.
So my next question is obviously linked with this. So why does one need, and how does one decide what is the best insurance to take? So what would you recommend is a good cover and value for money?
Yes. So there are a lot of things that need to be considered when you're deciding a health insurance product. Normally, when we say health insurance coverage, it's termed under a table of benefits. And there are a lot of aspects to that. The most important is the annual indemnity limit, or your annual sum insured, which is the maximum amount of money that you can get for a particular duration of the policy, which is mostly 1 year.
Okay, excellent.
Apart from that, then you have the geographical scope of coverage, which countries you are covered in. So you need to understand where you might be working, or you might have to go for a trip, either personal or a leisure trip.
Absolutely.
So all this needs to be taken into consideration when deciding the geography. The third part is the network, which is the most important part. So you need to understand the providers or the hospitals or the clinics which are included. It don't just go by the number of the providers, go by the quality. So the hospitals should be adequate with regards to your location, geographical location, where you are, accessibility in terms of the local location.
Sure.
So this is the important part. Then comes your benefits. So you have a list of coverages. What are the inpatient coverages? What are the outpatient coverages? These are generally standard in the market, at least in UAE, because it's governed by the regulators. Apart from this, one of the more important considerations will be your out-of-pocket expenses.
Okay, the co-payment.
The co-payment, the deductible, right? this is specified, and this is one of the important expenses that you might have to face. But although it's limited, but still it needs a due consideration.
Okay.
So the benefits are tailored according to the premium, and co-payment is a way of enforcing discipline into the policy. However, it's you can investigate or compare the products to understand what is the out-of-pocket expenses that you need to cover.
Okay. You were talking about inpatient and outpatient. So what do you mean by inpatient treatments and outpatient treatments?
Okay, so there are two types of treatments or encounters that you have when you visit a health provider. The health provider either can be a clinic or a hospital or a diagnostic center and other things. So when you have a routine ailment and you have a certain complaint, you're not feeling well, you visit a clinic and check with your doctor for a consultation. This is run as outpatient because you don't need to get inside the hospital.
Yeah.
Normally it just lasts for maybe an hour or so, depending on you and the nature of your disease. So at the most you will have a consultation and a prescription from the doctor, or if it requires further investigation, then some tests will be prescribed. All these are termed under the outpatient benefit.
Okay.
However, inpatient would mean that you need more intensive treatment in terms of either a medical management or a surgery. This can happen in two ways, either as an extended hospitalization of more than 2 days, or sometimes because of the advancement in medical care, the treatments which used to take more than 2 days can be handled within 1 day now, which are termed as day care surgeries. For example, cataract or even laparoscopic procedures. These are handled within 1 day, so you get it discharged on the same day. This also comes under the inpatient.
Okay, excellent. So doctor, you were mentioning about health insurance and the benefits of that. My question to you is, like, I could buy insurance on my own. Vis-a-vis me getting in, I could pay the treatment on my own. How does health insurance benefit me as a customer or me as a person who's taking insurance? How do I get benefited by that?
This is, I think, the most important question of why I need health insurance in the first place.
Yes.
So there are a lot of answers to that. The most important answer is the protection of your financial risk when you're suffering from a disease like we discussed earlier. All this fact. Apart from that, another important aspect that needs to be considered, and it is one of the most overlooked or intangible in terms of the importance, is the control aspect of the treatment part. So firstly, when you're going as an individual patient, you're on your own with the doctor in terms of understanding the nature of disease or the treatment that is prescribed, or having all the alternatives in front of you.
Yes.
So you are at the most given one or two options.
Yes.
Plus the treatment that is prescribed, there is no cross-check over it unless you decide to have a second medical opinion done on your own.
Yes.
With regards to health insurance, and the doctor is aware that you are an insured patient, in the back of my mind, everybody knows that this treatment option will be monitored by a professional who is sitting outside the table, giving an approval or monitoring the claim for the insurance. Apart from that, it's not just a one-way check, it's a two-way check, because in this market, most of the services are provided by a TPA, which is a third-party administrator, and then there's an insurer in the background.
Absolutely.
So, firstly, it's done by the TPA, and the second level of check happens through the insurer. And this is another important considerations when you buy a policy, that you need to have a very hands-on insurer who is in touch with the ground realities and who is in touch with the providers, so that you get a better control over it.
Absolutely. So basically a person gets the advantage of advice, 2 layers of advice,
Exactly.
And there's a maker and a checker to it as well.
Definitely, maker checker is always there.
Excellent.
Plus,
Excellent.
you have a varied scope of alternatives which can be given to you. Plus, you can get green channel facilities like consultation arrangements, appointments, facilitation of the dates of the surgery. Hospitals have a relationship at a corporate level, so they will try to address the shortages or the things first with the insurance patient, then with the individual patient.
So there are some more questions, like questions like medical insurance is already provided by employers here in the UAE. So should one look at upgrading it, to cover any other benefits like maternity, etc.?
Yes. Like what I was discussing earlier. Now, generally, there are two types of policies. There is a group policy, which is taken by a corporate for all its employees, and then there are individual policies. What happens is, because the group policy is for a pool of people who are working together, so the risk gets spread. Because of this, the benefits are more for the same amount of premium that an individual pays. Because at the individual level, the risk is more.
Exactly.
So technically, you should be getting more coverage in a group policy than an individual policy. And if somebody is having this concern that he is not covered appropriately, then I think he will need to discuss it with his HR or employee benefits team to understand where is the gap, and maybe guide them or give your suggestions on how the policy can be up to your satisfaction.
Absolutely.
Otherwise, the second option would be through again your HR or employee benefits team, getting in touch with your existing insurer.
Yes.
And checking with them on the possibilities of add-on covers for the policy, group corporate policy.
Absolutely.
So there are insurers who can give these extra benefits by charging a premium which you can pay at an individual level for the people interested in it.
Oh, excellent,
Yeah.
excellent. So there is flexibility basically.
There can be a flexibility, depends on the insurer.
Absolutely.
The third aspect would be buying another product at an individual level with the specific sets of benefits that you think are lacking in your policy. So that can be customized to a certain extent, but the premium is a consideration.
Okay. And what happens when suppose if a person's Emirates ID is expired and it's under renewing or whatever, so is the cover still valid?
Yeah. What happened during the last few years is, because of the integration of Emirates ID, normally there are two valid documents or cards that you can provide to the clinic or the hospital, the front office, for identification of your direct billing. One is your insurance card, if you have a physical card with you, insurance, just the health insurance card. And the second is the Emirates ID. Emirates ID is accepted throughout in UAE.
Yes, right? It is.
And this is one of the primary identification points, identification document for your benefits. Now, if your MS ID has expired, either you have the option of presenting your health insurance card, or if you don't have it, many insurers have this option of soft copy of your prescription card.
Yes.
You can give that. The third option is, anyways, the MS ID number will always be the same.
Yeah.
So you can still
provide
the MS ID with them. The policy doesn't have any limitation. Policy is there for a particular period. It doesn't expire with the expired MS ID.
Okay, got it. And last but not the least, of course, thank you so much for your time. I would like to ask, what is your message to people out there and the viewers and people who are linked with health insurance or hesitate taking? What is your message to people?
Again, like we have been talking about health insurance, not as an expense but as an investment. It's very much required for all the reasons that we have just enumerated. It's for your protection. Don't consider it as an expense that you will be paying, or on the other side, don't consider it as a credit card that you will be claiming in an unhealthy way. Because again, I would say everything has to be taken responsibly. The expense will decide the renewal premium. So whatever is required definitely has to be done. But if something is not required, it has to be limited.
Thank you so much, Doctor, for your valuable time. Thank you for the job that you're doing. You're impacting so many people's lives, making so much of difference, as I already said. Keep protecting, keep inspiring, and then keep ensuring the...
Thank you for your kind words, Aarti. I really hope that more people get involved in having this understanding about insurance, and watching your channel and watching your videos are giving a lot of enlightenment for this particular aspect.
Thank you so much.
Thank you so much for having me.
Thank you.